My daughters, Harriet and Georgia, are 20 months old, so just over a year and a half. Harriet was born first. She's 2 minutes older, and she is a little firecracker. It's a really interesting contrast to Georgia, who is very easygoing. You flip it over. There you go. I thought I was more prepared to be a mom when I was pregnant than anyone actually ever is. It really surprised me that I would be somebody who would get postpartum depression. I remember thinking that it was really sad and really unfair that it felt like everybody could take joy in these little babies except for me.
Our future is based on our ability to have healthy mothers and healthy children. So postpartum depression is such an excellent example, knowing the very powerful impact that a mother's depression can have on her child and her relationship with her child.
The years 0 to 3 are so critical for every child, and there are many components that go into those critical years. Whether or not the mother had prenatal care, a healthy birth, early learning opportunities, the mother's mental well-being, all of that goes together to make sure that those first years in a child's life are as successful as they can be.
When I realized that I really needed help, the first organization that I reached out to was my OBGYN. And within just a couple of months of being on medication, I felt a lot more like myself again. Sometimes I like to think of the three of us girls as like the three musketeers. We go out in the world, all three of us together, and it's really special, and I'm really grateful for it. Over 50% of women with postpartum depression don't get treated, don't get recognized. When Adriana told me about the bill that Texans Care for Children were working on, it was an easy thing for me to share my story.
My name is Louise Liebeskind. I represent myself, and I am in favor of Bill HB 2466.
Thank you.
My testimony in front of the committee, it really surprised me how good I felt about it afterwards. I felt really supported, not only by Texans Care for Children, but also by the legislators that were listening and the audience in general.
The bill that was passed in the recent legislative session was very important in providing mothers with an opportunity to have depression diagnosed. I'm so grateful for the advocacy work done by Texans Care for Children. In the next legislative session, I know that we will be advocating to ensure access to health care for women, and I am comforted to know that Texans Care for Children will be at our side.
I've worked with Texans Care for Children in many ways and am so impressed with their advocacy and their connections at the Capitol, the way they can get things done.
I didn't have to keep feeling like everybody got to enjoy my babies except for me. Everybody talks about how fleeting and precious those first years with a baby are, and it would have been really tragic to miss that. I'm really glad that I was able to be there for it and to be happy and to have a close bond with them now that might not have been possible. if even one woman gets that, they wouldn't have had it otherwise, I would feel really, really glad.